Myths. Infertility. There's no connection between this vaccine and infertility. It just wasn't tested very well in pregnant women because it's actually general practice not to do a lot of trials in pregnant women or in young children until the DART studies are done. And DART studies are looking at animal toxicity in neonates. And the DART studies have been done, and now it appears as though it's very safe. Those final results should come out at the end of this month. But the interim analysis is that there's no toxicity from this vaccine. The fact that it degrades in your arm in less than an hour really points out that the center of this immune response and everything that's happening is right here. They aren't finding it in placentas or in the tissue of the newborns in these DART trials, the animal toxicity trials, and that's very good sign. But they just didn't test it in them. And so there isn't as much data saying it's safe. Now, they also didn't test it in people like me who are immunocompromised, but that isn't stopping me from getting the vaccine because there's nothing different about me. I'm just less likely to respond to the vaccine than the people who have normal immune systems. In pregnancy, I know there are a lot of questions about this, and I think it's somewhat an individual decision. We did a town hall at the University of Chicago, and I met with a lot of our maternal fetal medicine specialists and our neonatologists, pediatricians, and our other obstetrician gynecologists. And they all said to a T, especially for people working in healthcare settings or the kind of settings where you all are, the risk of COVID is much greater to your baby and to you than the risk of the vaccine. The risk of the vaccine is all theoretical. There's not actually anything been shown or proven at all. And it certainly doesn't cause infertility in the long run. There's literally no targets in those cells that could possibly even be affected by this vaccine. So I don't think you need to worry about that, but I do think if you're pregnant and you're thinking about getting vaccinated, you should talk to your obstetrician about what the risk is to you and what the benefit is, because everybody's in a different situation and there isn't as much data. But we are encouraging our pregnant people to get vaccinated at the University of Chicago, and a lot of them have done so and been just fine. And COVID itself does cause preterm labor, and we don't know if it has long-term effects on a fetus. Does this get into your DNA? No. This is messenger RNA, and there's no back step to go from messenger RNA to DNA. And so this, unlike, well, some people have talked about other DNA vaccines that have been tried in the past, which are effective, but could actually change your own DNA. This can't. There's no way. Our body doesn't have any system for going backwards from messenger RNA into DNA. There are reverse transcriptases that are part of viruses like HIV, but those don't work on messenger RNA. So you just need to trust me and trust science, because there's no way that can happen. There are no microchips in the vaccines. In fact, they come in these vials with 5 doses in them. How would you know that you were giving which person which microchip? You can just know from that standpoint, it's impossible that there are microchips in the vaccines. Plus, there's no microchip that's small enough to fit 5 of them into one of these tiny vials. The other issue is, I think, largely with the rush testing. Yes, corners were cut, but those corners were bureaucratic, red tape, and largely about the duration of immunity and some add-on data, like they didn't test everybody with weekly or every other day nasal swabs to make sure nobody was carrying COVID around asymptomatically. And you can't really tell, because the only way to know somebody has been infected is to go ahead and check their antibodies, which are positive because they got the vaccine. So that's why you hear people say that you might be able to carry COVID even after you've gotten the vaccine. It's just that it's not that there's evidence that you can, it's that there's no evidence that you can't. And those are two totally different things. It's like saying that the scarf in this box is not purple. That doesn't mean it's red. It just means it's not purple. And in this case, we don't know the color of the scarf in the box or the COVID in the people. So we just can't tell.